Okay, let's continue with Chapter 9, Week 3, Cardiovascular System, Congestive Heart Failure. Now, it's a condition in which the heart cannot pump enough blood to meet the blood and oxygen needs of the other body organs. Complications of most forms of heart disease include coronary and peripheral atherosclerosis. Mild symptoms include ankle swelling, shortness of breath with exertion. Severe symptoms of CHF include shortness of breath at rest, not only at exertion, fatigue, limb weakness, neck vein swelling, rales, which are wet, crackling lung noises, pulmonary edema, fluid in the lungs, cyanosis, and abnormal heart sounds. How do you treat someone with CHF? Goal is to relieve symptoms, improving quality of life, and halting progression of cardiac dysfunction. Includes correcting the underlying causes, restriction of salt and water intake, modification of activities and lifestyle, medications, diuretics to improve cardiac output, antihypertensives, antiarrhythmics, in severe cases, sometimes bed rest. It depends. Well, again, bed rest as a last resort. We really don't like bed rest for any kind of pathology because that just leads to more secondary pathologies. What should the PTA do with someone with congestive heart failure? Should be aware of the psychosocial considerations of older patients with CHF. You should always monitor their vital signs. Use rate of perceived exertion range from 11 to 14, light to somewhat hard. Positioning, use the high Fowler's position. So you should definitely know this. The high Fowler's position is where the head of the bed is elevated at least 20 inches above level. Okay, so here's level and 20 inches. That's the high Fowler's position. And patients with CHF tend to benefit from that. So this will show up on exams. I've seen it on the board exam show up. So this is something that you should definitely pay attention to. Diseases affecting the heart muscle, orthostatic hypotension, again a decrease of greater than 20 milligrams of mercury in systolic blood pressure or a drop of greater than 10 milligrams mercury in diastolic with simultaneous pulse increase of 15 beats per minute or within 3 minutes of standing or head up to at least up to 60 degrees on a tilt table. You're like, oh my gosh, what's going on here? But those are some things that we have to monitor. Okay, typical symptoms, lightheadedness or dizziness beginning with a few seconds of standing, dim, blurred, or tunnel vision, dull pain in the back of the neck and shoulder. Symptoms may be vague, complaints of fatigue. Symptoms should be relieved by sitting or lying down. Again, with orthostatic hypotension, many meds used to treat hypertension can result in hypotension, particularly when combined with interventions or exercise that result in vasodilation. Heat modalities, whirlpool or Hubbard tank, moderate to vigorous exercise of large muscle groups, especially after exercise when venous return is diminished. As exercise abruptly ceases, cool down period is essential when you're working with someone. Okay. And again, with orthostatic hypertension, PTA may, under PT's plan of care, provide instruction to the patient, including rise slowly from the bed or chair after a long period of recumbence, lying down, or sitting to avoid loss of balance and prevent falls. Ankle pumps, raising arms overhead with diaphragmatic breathing, and abdominal compression prior to standing promote venous return to the heart, accelerate pulse, and increase blood pressure. So not only ankle pumps, but raising the arms overhead, raising up and down, anything that you can get the venous return, that will help increase blood pressure. All right, now some arrhythmias. So remember, the SA node is the natural pacemaker of the heart. If you were actually to remove the heart from the body, it would actually still beat because it has its own electrical system. You guys ever remember Indiana Jones and the Temple of Doom? That was a good example of where he took out the heart and the heart was still beating. So arrhythmias are abnormal heart rhythms developed from irregularity in impulse generation and impulse conduction. Two categories, supraventricular, include those that are generated in electrical abnormalities in the SA node, the atria, the AV node, and junctional tissue in the heart. The ventricular include those that are generated in the ventricle conduction system and in the ventricle. More serious because ventricles are the pumping chambers. So those could be defects with the Purkinje fibers, if you remember your cardiovascular anatomy. All right, so what are some disorders of cardiac rhythms? You get tachycardia, boom, 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 drink a lot of caffeine, greater than 100 beats per minute, bradycardia, less than 50. You know, Lance Armstrong, when he was fit, his resting heart rate was 30 to 35. So if you were to take his heart rate, you probably couldn't feel it. You would think he's dead, but he was that efficient. Heart block is an interruption in the flow of impulses through the conduction system of the heart. Results when impulses are blocked, causing the atria and ventricle to contract independently of one another. May slow the heart rate to the extent that blood flow to vital organs, example the brain, is blocked. Ectopic pacemaker, an excitable focus outside the normally functioning pacemaker of the heart, can cause additional beats or take over the normal pacemaker activity of the SA node. So you'll see some patients with SA pacemaker, and those are some of the precautions that you would take. So you wouldn't do electrical stim around that. You wouldn't do ultrasound with pacemakers because you can disrupt the normal activity of those. Okay. Fibrillation, result of disorganized current flow within the atria or ventricle, interrupts the normal contraction. You can get ventricular fib or atrial fib. So ventricular fibrillation, the ventricle quivers, does not contract and carry out effective coordinated contractions. Because no blood is pumped from the heart, VFib is a form of cardiac arrest. Immediate attempts of resuscitation must be made or death will result. So ventricular fib is much more dangerous than atrial fib. Okay. Cardiac rhythm disturbances, some signs and symptoms. You get palpitation, syncope or lightheadedness, edema, shortness of breath. Treatment, medications, electrocardioversion, and catheter ablations can occur. Now, what is the role of the PTA during arrhythmias? PTs and PTAs exercise many people with a history of heart disease or known risk factors for cardiac disease, and thus there's potential for needing to perform CPR. Ensure advanced cardiac life support equipment is available in case of emergency, and monitoring and observation of patients before, during, and after activity. Again, implications for the PTA, besides the medications that may be used to control arrhythmias or slow heart rate, some patients wear a battery-powered pacemaker, which is implanted underneath the skin, usually in the anterior chest wall. Right here, you can see it. After initial placement of pacemaker, patient may be limited from strenuous activity using the arms, so lifting overhead, you got to be careful. PTA should be aware of the patient's underlying problem that necessitates the pacemaker as well as the type of pacemaker before monitoring patient's response to activity. There's a pacemaker. Sometimes you'll see it on the left side. Sometimes you might even see it on the right side. It doesn't matter what side it is on. Pacemakers and implantable cardiovertebral defibrillators. Avoid MRI and prolonged exposure to electromagnetic waves. Avoid use of electrical stim and ultrasound in or near the area of the pacemaker. Now, technically, let's say they have a pacemaker and you were going to do electrical stim on their ankle. It's a precaution, it's not a contraindication, but do I do it? No. If they have a pacemaker, I don't do it at all. Why take the risk? I just say, no, can't do it, and to be done with. So, but there are some different guidelines depending on which pacemaker. If you have any doubts, obviously contact the MD and say, hey, because I had a patient that had a pacemaker and he wanted electrical stim. I said, oh, I need a letter from your cardiologist. And he went and got the letter from the cardiologist, said that he felt that it was fine that he got the electrical stim on his back, and got the letter, and it was fine. Actually, it was interesting. He gave him this interesting magnet that he would tape on his pacemaker, and it would stop it. Not the heart, but the pacemaker from working. It was and then he would get the stim, and then afterwards he would take the magnet off. It was a very interesting. Again, it's too much of a hassle. The risk-reward ratio is too high. So when in doubt, I don't do any electrical stim with patients with pacemaker. Okay, and if you kind of go with that flow, it should be fine. Now, if a patient is persistent, tell them to go back to their cardiologist and get a letter from So you can put that in their medical chart. Observation of patient for associated signs of depression and or anxiety as a survival of cardiac arrest has been compared to post-traumatic stress, PTSD. All right. Now let's talk about the heart valves. Actually, yeah, we'll talk about that. Mitral stenosis, mitral regurgitation, mitral valve prolapse, aortic stenosis, aortic regurgitation, and infective endocarditis. All right, so valves maintain unidirectional flow of blood through the heart. Disorders include stenosis. Stenosis is a hardening, narrowing of the valves, opening and failure of the valve to open normally. Produce distension of the heart chamber that empties blood through the diseased valve and impaired filling of the chamber that receives the blood. Valvular insufficiency refers to a valve that allows backward flow of blood within the heart, produce distension and strain the chamber, ejecting blood through the diseased valve. So if you look at that, here's the mitral valve. So the mitral valve opening is narrow and the cusp that form the valve become rigid and fused together. Increases resistance to blood flow from the left atrium to the left ventricle as back pressure develops in the left atrium and the left atrial wall hypertrophies. Okay, so this is bad news here. Mitral stenosis, you're going to have some chest discomfort, which is rare, increases with activity, decreases with rest, radiates to the arm, neck, jaw, or other areas, tight crushing pressure, squeezing, constricting, cough, possibly bloody, difficulty breathing during or after exercise or when lying flat, may wake up with difficulty breathing, fatigue, become tired easily, frequent respiration infections such as bronchitis, sensation of feeling the heartbeat, palpitations, swelling of the feet or ankles. So that would be indication or symptoms of mitral stenosis. How do you treat mitral stenosis? Vulvuloplasty, which is a surgical technique similar to angioplasty used to widen the valve and restore blood flow. If valvuloplasty results in a leaky valve, it might be surgically replaced with a metal alloy or a pig valve. So my uncle had that surgery. He had the pig valve, and then I had another relative that had the metal one. The ones that are replaced with the metal one, you have to take blood thinners the rest of your life. Okay. If you have the pig valve, you run the risk of rejection because of your immune system, right? So pros and cons to everything, every surgery. Mitral insufficiency, which is mitral regurgitation, the valve is unable to close completely, allowing blood to leak into the atrium each time the ventricle contracts. As blood volume pressure increases in the left atrium, the BP increases in other vessels, including those leading from the lungs to the heart, resulting in lung congestion. Another cause is failure of specialized valve muscles in the ventricle called the papillary muscles, resulting in mitral valve prolapse, MVP. Most with MVP are asymptomatic but take antibiotics to prevent bacteria from colonizing in the defective valves. In severe cases, valves can be reconstructed or replaced. There's mitral valve regurgitation where the blood can go back. What if they have aortic stenosis? Aortic stenosis is a narrowing of the valve leading into the aorta, resulting from rheumatic fever, congenital defect, or arteriosclerosis. Characterized by rigid cusps that adhere together in deposits of calcified material, which give a warty appearance to the valve. Because left ventricle pumps blood through this narrowed valve into the aorta, this chamber hypertrophies. Even with enlarged ventricles, inadequate blood flow to the brain results in syncopal episodes or fainting, and valves can be replaced surgically. Okay. What about aortic regurgitation? In aortic insufficiency, the valve does not close properly. Therefore, with each relaxation of the left ventricle, blood flows back in from the aorta. Backflow causes ventricles to dilate, become exhausted, and eventually fail. Can result in inflammation within the heart, endocarditis, or dilate the aorta. Symptoms have gradual onset, starting with murmur, progressing to dyspnea on exertion. Treatment is usually surgery to replace the leaky valve. Okay, so the last part is how does the PTA Monitor patients with heart issues. Well, exercise levels and intensity varies with specific diagnosis and severity, so everyone's different. You should always monitor the vitals, but always use the rate of perceived exertion, may be used as well. Dyspnea, which is shortness of breath. What does the abbreviation DOE mean? You know what DOA is, right? DOA is dead on arrival. We don't want that. But what does DOE mean? What does the abbreviation DOE mean? Make sure you know that. Did you figure it out? Dyspnea on exertion. So shortness of breath on exertion. Post-rehab is similar to that used with patients after a CABG. All right, so post-rehab for valvular surgeries is the same as precautions such as for CABG. All right.